Hello, welcome. Before we get started today, I wanted to mention our Patreon channel where you'll find some really great exclusive content. If you're interested, you can find the information in the link down below. I look forward to seeing you there. Anytime that you are approaching someone and you're about to do deep tissue in the neck, you want to spend a good amount of time just making sure that they feel comfortable and relaxed. And there are certain areas that really contribute to a lot of contraction, especially in the sternocleidomastoid, that SCM muscle. Anytime that someone is in the habit of clenching their jaw, that muscle is basically always like at attention. And something that I like to do is, with intention, just go into these temples. And sometimes you can really encourage your client to just relax around that jaw area and just their face in general, which can help the whole massage go more smoothly. And this is just a very soothing way to begin this kind of massage. I don't usually start by putting my hands on the jaw because it's a little bit weird way to start. I just like to kind of gradually work my way down. And this would be the perfect time to communicate with your client the importance of keeping a soft jaw in general. So often we just lose awareness of our body. When we're going about our day, we don't think about our jaw, we don't think about our body. Just bringing that mindfulness into your day can make a world of difference. With chronic neck pain, just that mindfulness is key. And it's not like one day you're not mindful and the next day you are. It's a constant practice of just bringing attention to your body and yourself. And I might even do a little scalp massage. That's a really nice way to kind of start moving towards the suboccipitals. So this is one more thing that you can do to just help your client to relax. When the facial muscles relax, the neck tends to relax, and there's a ton of nerve endings on the scalp that just feel lovely to have massaged. Really helps everything to soften. And again, I don't want to linger. I'm aware that this isn't like a Swedish style massage. I'm staying focused. I'm not lingering too long. Not rushing either. So I'm a little quicker to turn the head, and I might even land on the temples a little more, making sure that Michelle's head is supported as I work. Really encouraging the temples to relax. And one area that I'm always sure to work on is the mastoid process when I'm about to do deep tissue in the SCM. That area behind the ear. And gradually working my way towards the suboccipitals. It can be really beneficial to rub on the occipitalis to begin. You're already right here. And just putting some pressure on that thin superficial muscle can communicate to the neck that it's safe and it can relax. And this is kind of the moment where I'll start to kind of shift a little bit, and we're gonna start doing some compressive work along the hairline. So focusing quite a bit on the suboccipitals. And I start with my finger pads. It's a very tolerable way to feel pressure on this area. And I have a lot of sensitivity. So I can kind of read Michelle's neck pretty well and where I need to focus on. And the whole time making sure that Michelle's head is supported. This is an opportunity for me too to get a nice visual of the SCM. I'm looking for anything that looks swollen. You can kind of tell if the SCM is out of balance and really tight just by looking at it a lot of the time. So probably the easiest way for me to do the suboccipital work would be with my knuckles. I find that it's the least satisfying way, but it's sure a relief to not put any pressure on those finger joints. I usually kind of weave in and out using different hand positions. My favorite is with a thumb. So I'm making sure that I'm at a nice angle, I'm not straining. And so I have a pretty good read on the areas that need a little more attention. So I'm just gonna start going in with less of my finger pad and something that's gonna feel a little bit sharper, but not too intense, hopefully. My thumb's at a really healthy angle. I'm not putting a weird kind of pressure on my thumb joint, and I can still offer a good bit of pressure. I would say it's really important to address the suboccipitals before attempting deeper work in the SCM. And all of this is just going to help the SCM to relax without even thinking about it. Some people get kind of fatigued with the deep tissue faster, and you can always give them little breaks. Other people really like to have a hyper-focused massage where they feel like you're working the kinks out faster. You really have to read your client. But no matter who it is, it's important to give some type of break. And just rubbing on that occipitalis. Which is actually a very productive thing to do as well. And if you are new to doing this type of massage in the neck, I would encourage you to, even with your finger pads, just walk down, and you can really feel for any swelling in here and get a really clear sense of the area that you're about to work on. I'm going to do that same routine on the left side. And more often than not, one side of the neck is going to feel tighter. It's going to carry a heavier load. It's often on the dominant side of the body. Again, just landing on that mastoid process and lingering here for a bit. This is also going to help relieve that sense of pressure in the forehead, which is very, very good. Moving to that occipitalis. You can also do little circles. You don't have to go up and down. You can kind of do whatever is most comfortable. Just a fairly light touch above that hairline. And once we land on those suboccipitals, starting to introduce more pressure. And I just wouldn't rush, this work on the suboccipitals. When you do good work for these muscles that help support the neck, like you're helping the whole neck. It's one of the most important areas to work on when you're thinking long-term benefit to the whole neck. And always moving my chair over so I'm at a better angle with my thumb before I go in. It can feel kind of nice to offer the neck just a little bit of a stretch before you go in with your oil. So I am just like catching with my finger pads, and I'm gonna grab my oil. So I don't really know until I have my hands on my client for the first 10 minutes. Sometimes I will really linger in that space without the oil because you have such a nice hold on the muscle fiber that I might spend half of my time there without oil before going in with the oil. Really like to walk the shoulders, just encouraging them to relax. And I love including the upper traps. Especially after that suboccipital work. So with this hand position, it's really important that you keep your hands somewhat relaxed but firm at the same time. And this is also really good for the suboccipitals if you continue that stroke a little further. And starting to move closer to the SCM. With this hand position, I'm more focused on the upper trap and the suboccipitals. So we're at a perfect place. We did some really good work in the suboccipitals. We touched on the upper trap. This SCM should be ready for some trigger point work, but you definitely want to ease into it still. One of the best things you can do for the SCM is to encourage greater blood circulation, and the deep tissue is fantastic for that, but you don't want to damage any muscle tissue. So you want to make sure that that muscle is responding really well. You're never trying to force anything. So really important that you just gradually kind of make sure that that muscle is responding well. Right now, this is technically an effleurage stroke. I'm just working that soft tissue still. And what I'll start to do is, as I sense the areas that need deeper work, I will just go from about a 4 to maybe a 6. And kind of inch my way down. And you can move a little faster on, clients that you see regularly, but I'll usually really take my time here. This area is one of the most uncomfortable to have worked on, so just really take my time. And after about 3-4 passes, we can kind of start exploring, deep tissue. And so I'll just gradually work my way in a little more, then release. And so I don't want my client to feel like I'm just poking their muscle. So I will use a good bit of finesse and also giving just little micro breaks. This technique can be super healing if it's done in the right way and if you take enough time. And just remember that you have a whole other side to do, so definitely budgeting time well. And this is just a great moment to have your client experience how it can feel good having that muscle worked on. Just helps the muscle to relax. I don't want to just turn Michelle's head and then go right in with my thumb. And just gradually. And even, when you sense that your client's ready for the deeper work, it's not like, okay, I'm just gonna press as hard as I can. Like even within that process, you're using a good bit of finesse, because it really does help that muscle tissue just open. And it's really important to not hold back too when the muscle is responding well, that muscle tissue is opening. Like you kind of have to be very firm in your approach if you want that true deeper opening. And you don't necessarily need to spend 20 minutes here. Sometimes it's more about quality than quantity when it comes to this area. And just like how I started, I don't want to do deep tissue and then just stop. So I want to kind of help that area calm down a little bit, flush it out a little bit. And I always like to do some effleurage at the end, passing over the hairline and ending in a way that feels pretty relaxing. And that is all for today.
Welcome to Yoga Plus. Courses available from pupil to yogi. Sort by yoga, fitness, and instructors. Create your own routines. Access the Pose Library. Yoga Plus by Psyche Truth, available on Google Play and the App Store.
Join us for 14 and 30-day programs, hour-long classes, and much more on our yoga app, Yoga Plus by Psyche Truth. It's free to download and features a variety of wellness content, including yoga, fitness, Pilates, guided meditations, and interviews with dozens of wellness experts.